my name is Julie Magnuson, Research Project Manager for the Immune Deficiency Foundation. I'm going to be your moderator for this presentation. This session is 45 minutes in length, and we will be sticking to that time frame. And if time permits, afterwards, we'll be happy to take a handful of questions and maybe have a short demo after the presentation. Please also note that the information presented during this session is not medical advice, nor is it intended to be a substitute for medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with questions concerning a medical condition. And here at IDF, we offer a wide array of educational presentations, including presentations developed by healthcare and life management professionals invited to serve as presenters. The views and opinions expressed by guest speakers do not necessarily reflect the views and opinions of IDF. But without further ado, I'm proud to introduce our presenter, Dr. Rafi Toshtian. Dr. Toshtian is an Associate Clinical Professor of Medicine and Pediatrics in the Division of Allergy and Clinical Immunology at the David Geffen School of Medicine at UCLA. He is also the founder and president of Children's Music Fund, a 501c3 that brings music therapy to children and young adults with chronic and life-altering illnesses. His research focuses on severe asthma, hereditary angioedema, and rare diseases. He also produces music with proceeds going directly to charity. And again, for full presenter bios, you can visit your conference app. But again, without further ado, welcome and thank you for joining us, Dr. Toshtian.
Thank you, Julie, and thank you all for attending this kind of unconventional presentation on music therapy. It's called Healing Notes because we all need a little healing here and there. I'm Rafi Toshtian. I'm truly honored by the IDF asking me to present on behalf of the organization. One of our favorite quotes is, "Where words fail, music speaks," by Hans Christian Andersen. So quick little bit of definition first to start, all right? Part of the menu. The National Institutes of Health, National Center for Complementary and Integrative Health defines complementary as therapy that's used along with standard of care. Alternative is non-standard treatment in the place of standard of care. And integrative is really focusing on the patient at the center, and it's evidence-based and utilizing mind and body practices. Now, what is music therapy? Well, because some of you here probably have your iPods, you probably might listen to it to fall asleep, you might have it in your car, and there might be background music, elevator music, etc. It may or may not work depending on how in tune or how aware or how engaged you are. Now, if you got a left knee that's hurting, that might start taking over and win, and all of a sudden the music's not in your conscience. We actually use music clinically to accomplish these individual goals that a patient has after assessing the patient's strengths and the needs and providing treatment. And this is done through creating song or creating lyrics. If you don't have any musical talent, don't worry, we're not going to call on you to jam away, some Eddie Van Halen guitar or Mozart, or Bach piano. There's singing that could be involved, moving to the sound, and sometimes it's just listening to music and reflecting. Now, passively, it's music listening, and that could be done too. And you hear about this before surgery. Even the surgeon might put it on to treat themselves too, to calm their nerves, all right? Actively, we engage the patient to help create this live production in the end so that at that musical piece that might be even recorded, all right, say Kat records it with her music therapist, in the end she might have that piece for each time she might have whatever the issue might be, a pain, anxiety, fear of a next procedure, and then remember that she is part of that final product. Imagine if your hands played two notes, you sir, on a piece that's on Spotify. You're like, that's me, okay? I actually know the guy who's a big benefactor of Children's Music Fund who played Jump for Van Halen. I'm like, that was you? He's like, just my hands. And, they called me because the guy, he was a little out of commission, Eddie. And I'm like, wow. But he's like, every time I hear Jump, I'm part of it. And then there could be lyrics, depending on the level of engagement. And to do that, our music therapists have a bachelor degree or higher. Sometimes they have a master's or beyond. And there are 70 or more American Music Therapy Association approved schools or colleges that provide this program. And the music therapists, once they're done, they're on this registry list for qualified for practice. And lastly, the ones we take on have the 6 months practicum that they did to become board certified. So it's not just enough to finish your music program, you're also getting a board certification through 6 months, which this is something I helped start at Mass General and Boston Children's with Berklee College of Music. That way they get a direct feeder into practicum life. So when we think of music therapy in action, I want you to take a quick second and think about, on a scale of 0 to 10, you don't have to tell anybody else or me about it, how do you feel right now? Whether it pertains to pain, fear, anxiety, or just your body. Take a quick second, just mark that number, okay? Close your eyes for a second. This could be your IV line. It could be your child's IV line. 3 letters I always hated as a resident, you know, pain occluded. So take a second now, as you just thought of that negative kind of connotation. Did that number go down by just show of hands? Okay, all right. So keep this number in mind too. So switching back to music therapy in action. So what do we know so far? In cancer care, it's actually validly used to improve pain, decrease muscle tension, help relaxation, and it's been shown to improve anxiety, depression, fatigue, and quality of life. Quality of life, a big thing that we finally now in rare diseases, chronic diseases, are really addressing instead of just, am I getting treatment? Am I getting less need for a hospitalization? Like, how am I doing as far as a human being? And across a number of trials, there was a large effect on anxiety and depression, a moderate effect on pain and quality of life, and a small impact on fatigue. And when we look at the Society of Integrative Oncology, so from our cancer therapy colleagues, it's actually recommended there for reducing anxiety and stress and for improving mood disturbance. And they think it's considerable, or it could be in consideration for management of pain. And it can also be offered for surgical pain from cancer surgery, but not in other settings. I'm going to translate this for you. We haven't done enough work in music therapy to have it apply to, it's coming soon, immune deficiency even, all right? So when we think of musical interventions in the medical setting, there are a number of studies. In autism, we've seen improved interaction, eye gaze. In decreasing arousal due to stress, here we've got small effects, but you can see that stress techniques can improve by having a music therapist there. As far as blood pressure, there are some improvements in heart rate, basically your vital signs. And then this was a study 23 years ago that showed IgA. Remember IgA? But salivary IgA. So the scientific validity of this is up to debate, but improved in the salivary concentrations after music therapy intervention. And then in behavior modification in autism, to show that it's more effective than just reading and other interventions. As far as the neurochemistry of music, we've seen it both help cardiac surgery patients, and then depending on what kind of music it is, if it's arousing, so it's kind of just too stimulating for the patient, it could increase plasma cortisol, so it can go in either direction. And one person's Metallica can be someone else's Mozart. As far as workforce analysis, we know that there's a lot of work to be done still, knowledge gaps that we're trying to improve on, and really to show how we can overcome these boundaries of creating a happy or a content patient out of someone that might be stuck in sadness, whether it's day after day or just bursts of it. And then for depression, limitations in design for these studies, which just goes to show that not enough people, statisticians, scientists, etc., are involved in this kind of modality to help see if it works or not. And then when we think of traumatized children, so helping engage them into the therapeutic effect, build more relationship, because think about it. I mentioned earlier, you might listen to it in the car, but imagine if in the car, sir, who's your favorite artist? Name one or two.
Garth Brooks is one.
Imagine Garth Brooks is taking a ride with you down the highway and has his guitar. It's a completely different scenario, okay? But your music therapist is actually trained beyond Garth Brooks to overcome your challenges for the day. So you can see where the effects can be. And so now I'm going to switch gears to what our organization does with various entities. It's called Children's Music Fund, providing children affected by chronic conditions or life-altering illnesses with music therapy to help them on their journey towards better quality of life. It's a 501c3 that that basically gets music therapy out to patients 0 to 26 years of age. It's fully funded for eligible patients. We're now actually in more than 10 states, plus England, funny enough. We got some UK representatives here. We gift instruments where a patient would like that. Just recently we did a project with a rare disease group where literally 2 days ago I had to ship out a ukulele and a guitar to the recipients because that's what they wanted to interact with the music therapist that actually plays that instrument. And then we do some of the research, we publish, I'll show you some of the results that we have, and we're trying to improve these treatment options as an ancillary to help establish this as part of the standard of care one day. And then advocacy for financial support, because whoever has a replaced knee or a grandma with a knee replacement, 40 years ago, the surgeon would have said, I replaced your knee, Nami. You should be fine. Go home. Now, it's actually negligence and malpractice to not set you up with a physical therapist. So replace physical with music therapist. I mean, this is therapy. And we always think of rehab after the fact has happened. I believe in prehab. Start before the event if you know it's going to happen, an intervention. So you strengthen that mind, body, and soul of the patient, and then whatever the intervention is, whether it's an infusion, etc., and continue on with the rehab, recapping on, can we improve this? But we need help, obviously, on the advocacy side to make this eventually an insurance-covered entity. Now, 23 years ago, this young man, I carry his torch, Justin, I was his intern, and he was 15. And I was handed 40-some kids as I'm on call, and the sweetest co-resident of mine said, you got this one, a diabetes one, an oncology one, etc. And then there's this last one, Justin. He's just waiting for his day. I'm like, what? Terminal osteosarcoma, okay, had failed all the protocols, one last ditch at Mass General. So I walked into his room first, and he was staring, I thought he was staring at the TV screen, and the TV was off. He turns to me, I said, hi, I'm Rafi, your new intern. And he was kind enough and noble enough to say, I'm Justin, you probably want to know why I'm here. I'm like, wow, you probably get asked this 5 times a day. I said, you know, forget why you're here. What do you want to do while you're here? I'm going to make it happen. And I threw the notebook. I'm like, I don't care about notes right now. And he goes, really? I want to play the guitar. Okay, what do you play? He's like, Green Day, Rush, Red Hot Chili Peppers. Those 3. And I'm like, Rush? You weren't even born when I was listening to Rush, you know, back in Montreal, which they're from Toronto. So all this to say that it started with Justin, where I felt there is no good sound. Remember the beep I played you guys? It's either a beep, some kid crying next door, or sometimes even worse, no sound in the hospitals, in the clinics. So this is where it kind of got born out of that idea. So I founded this in 2002. We've got over 10,000 hours of music therapy under our belt right now. It's available in any state thanks to the pandemic, because we're telemedicine based now. We can get to any recipient. We work with these rare disease entities, sponsor music therapists now to complete their practicum, which helps us out with more hands on deck. And like I said, I'll get into the publications because we want to enrich that database and help make this a better entity. Why music and medicine? Well, music therapy is as old as medicine itself. In fact, it's primordial. Let me tell you, who here has a pet? Has a dog, let's say? Dog? Okay. Do you talk to your dog? In what language? Several languages. So your dog is multilingual. I love it. Now I'm going to ask you this. Can your dog read what you say, like your friends do? Or do you think it's the intonation of how you're speaking to your dog? That's half the time of how we react, right? If I gave this talk in a very quantized way, 90% of you guys would be walking out of this room. Instead of a humanized way, right? There's like a connection there. That's what's happening with music therapy. You're bringing back that primitive communication that even a bird chirps to another bird back to society, because a lot of it's been taken away. And that history of music parallels that of medicine. And we're looking at these biological rhythms. When you get on a drum circle, you've seen little babies. They're not trained, but in their little bassinet, they're kicking their legs to the beat of the drum, and they're 6 months old. We have it, we're just not using it. And so I'm going to now shift to the clinical program that we have, starting with the NICU. This is really exciting. These are the little babies where we've seen in the first 2 weeks of life, oxygen saturation can decrease or increase, heart rate can increase because they're stressed, blood pressure, pain scores. And there are a few research entities that have studied non-intubated NICU patients, because most of the studies are on like, let's get the severe babies with a tube, etc. And there are a couple of scales that we use. The FLAC scale, which looks at face, leg, activity, cry, consolability, as well as the NIPS scale, which is the neonatal infant pain scale, to determine these results. And just so you know, in the first few weeks of life, who here plays poker? All right, wow. Am I correct? This means stop, I'm good here, this movement. Same with the NICU babies. When you stimulate them too much, which is at the 20-minute mark, anything you do, whether it's joyful music, this, that, a baby will, within the little crib or the incubator, will do this, as in, get out of my face already, pal. Okay? So these are all hints that NICU specialized music therapists know to use so that they get better outcomes. And so here we sponsored a set of music therapy sessions. 94 patients, infants, aged 0 to 36 weeks, across 4 years in Southern California. There was a 48% decrease in pain, a 13% reduction in heart rate, and a blood oxygenation rate, you know the little red light in the finger with the tape? Went up for everybody, but for the girls, it went up by 6% more than the boys. I went back to the NICU. I'm like, what's happening here, nurses? And they're like, don't you know? Baby girls are smarter than baby boys. I was like, I guess I missed that part in my internship. But when you look at it, documented, if it's a boy-girl twin, this is anecdotal, the boy leaves a month after the girl does. The little baby girl goes home first. And it's been seen ethnically, actually, darker skin, faster out. So there's something resilience-wise, you see what I mean? So we're looking at something, oh, music therapy, we're doing them some good. No, we want to get to the core of it. What helps? And I want to know what doesn't help so that we don't waste donors' money. So this was really exciting, and there's a positive impact on pain in the first 5 days. but the number of patients obviously diminished, so we couldn't study it too long because they're getting better and better with this intervention and leaving the NICU sooner. Now, another program that we are in the second year of is with the Hereditary Angioedema Association. This is a genetic disease that's hallmarked by unpredictable swelling. It looks like allergy, but there's no trigger. It's not from food, it's not from environmental allergens, it's not from a penicillin or peanut you ingested. It's a different kind of pathway through bradykinin that modulates pain and swelling at the same time. So these patients, when they're swelling externally or internally, they're actually in severe pain. So here we looked at stress and anxiety as key symptoms and looked at these patients on a non-swell day, so an average day. Translation for you, if you got eczema, think of like your eczema is clear. It's one of those days. You don't have eczema. But you got anxiety about when's that next flare going to happen? Am I going to be able to go and enjoy that beach day with my friends, or do I have to wear this suit so they don't see all my lesions on my skin? So this was 12 weekly sessions led by 5 music therapists, up to an hour in duration and sticking by the guidelines. And here we saw the VAS scores. Remember that score I just told you to just jot down in your mind? From the high 5s dropped to the low 1s within that hour or less session. So a 77% reduction in that scale. And here we see that essentially it could provide HAE patients with improvements in VAS scores, even on a regular day. We looked at autism. So I had a postdoc come to us from ENT, ear, nose, throat, saying, can you fund my experiment on autistic children with autism? So we had 12 adolescents on the spectrum and 15 age-matched neuro controls. And here we saw all the markers improve: communication, happiness/life satisfaction, loneliness, boredom, pain, and their symptoms went down. So it was everything in the right direction. What we also found was that the higher frequency sound, so vocal sounds, the male patients could discern between quantized voice or humanized voice. So again, a differential to help these therapists intervene for that specific population. Immune deficiency. I'm preaching to the choir. Not many studies. In fact, I didn't see any studies on this. We need to do this desperately. We know that these conditions are underdiagnosed or not diagnosed. If you got a great grandma with your genetic trait, for instance, that's it. That diagnostic period, you hear a lot about, it might take 10 years, 15 years. For that great grandma that, God bless her soul, that's infinity years. We never discovered it for that person. So we're getting smarter with discovery. We don't have cures for all these inborn errors of immunity. And the immune deficiency patients, just like many other ones, are prone to mental health issues. That includes, and not exclusively, anxiety, depression, behavioral disorders, and we're lagging there. So that's something I've been speaking to the leadership about getting into. The one that we're also excited about, we're currently embarking in the next year, diabetes. There's one study that looked at lowering the hemoglobin A1C. You're familiar with that. That's the 3-month reflection of how well was your sugar controlled in the last 3 months. All it achieved was a decrease in the blood pressure. We're going to approach it with trying to put the music therapy pieces into how you eat, how you exercise. So it might be, guess what? What's your favorite piece? It might be a whole musical. You're going to be on the treadmill until that piece finishes. And that's your routine. Or you eat while you listen to or play a different track, etc. So there's no research yet on how well music therapy can work in this group, and we're really excited about this particular piece. This would be the same way, 12 weeks, because that's the, like I said, span of the 3 months for hemoglobin A1C to help improve, along with medication compliance, exercise, and dietary modifications. And here, this is a call to help. How can we get some more volunteers on board to help with fundraising drives when I present this to other groups, special events, grant writing, etc. All the things that the IDF does so seamlessly and beautifully. And then when we're out trying to do fundraising drives, we're trying to get either instruments or really the core of our existence, more music therapy sessions for these chronically ill or patients with life-altering illness. And when I say life-altering illness, it could be a cancer that was cured or in remission. It could be an immune deficiency that I might have had, you know, anything from gene editing to I'm good, you know, as long as I take my treatment. So. And then here's some pictures of another kid on the top left, and these are all with permission, who also had osteosarcoma, but he just made it fine. And the middle top two pictures, I don't know if there's a pointer, but are the folks at Berklee College of Music coming into the playroom at Mass General. Way to the right is Mike Lanosa with my co-resident Emily Katz, and he had come out of a brain surgery. You could see the scar. And then a couple of years later, we had Tom Brady, this is in Boston, come out, but it was Tom Brady meets Michael Lanosa Day, right? Because he's the celebrity. Some lectures at Berklee. In the middle, you could see Wangdar and Mike. They were my resident and fellows delivering an instrument to a patient. To the right, a young girl, again with a chronic illness diagnosis, who just wanted a hot pink guitar. Bottom left, a young boy at UCLA, another child at home getting music therapy services, and to the right, another young kid with the music therapist in the hospital. So I want to say thank you, but I'm not done yet, because now I want you to close your eyes, remember those numbers, and just ignore them for a second, and then close your eyes, and I want you to really dig deep into the lyrics. I want you to kind of melt into the lyrics.
This morning, smile with the rising sun. Three little birds flew by my doorstep, singing sweet songs of melodies pure and true, saying, "This is my message to you." Singing, "Don't worry about a thing."
Okay. You have a score now? Is it better than, hopefully, when I play the beep, beep? And for extra credit, is it better than how we started? Yeah? I mean, that's a resounding yes. Okay, everybody buckle up. Good. It's all about, so 4 years ago in, what was it, Maryland? I did a little demo on hypnotherapy, of going to a special place. And the reason I brought this up is, I mean, I'm not a music therapist, so I'm not qualified to do that, but when you close your eyes, and this was somewhat passive, but what I did is I said, try to melt into the lyrics. So you kind of owned up into the process. Any volunteers about how'd you feel about before or after, Kat, Belle? If you don't mind, sure. Here's a mic. Yep.
Yeah. Here's their mic. I'll record and chat. So I have psychogenic non-epileptic seizures. I usually get an aura before my seizures start. I listen to like Hawaiian tropical music, and some of the time it helps calm down my body where I don't have a seizure. If I have a seizure, I listen to the music afterwards, and it helps calm me down then. Music has been my therapy. It's helped my anxiety, my depression, my unprocessed trauma. It's helped me with my seizures in so many ways, and I'm so grateful for music.
Thank you, Belle. Okay. Oh, we got some questions.
What I was just going to say is, I don't know how you knew that Bob Marley was my go-to calming down music and how much I needed that, because my somatic nervous system thanks you very much. If we have time for questions, we'll take questions.
Yeah. I think
right.
Three Little Birds might have told me, but that was a pure guess.
That worked first. Okay, I'm going to pass the mic to Katie because I believe.
Kind of along those lines, and also Bob Marley should be everyone's go-to. But yeah, I think my question more relates to the primordial sounds and things like that, because recently I've been getting into sound baths and megahertz and things like that. So just kind of curious, what you guys have done in terms of incorporating that, which is like a little different and more meditative versus pop songs and things.
Great question. I'm going to back it up to a more 40,000-foot view. Do you know what the most popular music therapy requested song has been? Amazing Grace. But that's a biased question with a biased answer, because before Children's Music Fund, there was no attention to kids. I know that because I treated the first couple of Berkeley students in the ER, and I'm like, do you want your throat swabbed too? Because it sounds like your voice is gone. And the one girl goes, no, she's the voice major. I'm just a music therapist. She needs her voice. We have exams tomorrow. And I'm like, oh, who do you treat? And they said, elderly. The music therapy program or movement started for vets after World War II who came back traumatized. And it's stuck with adults. So that question is a biased question. And what's the answer that you're going to get? Vets, hospice care, the age is on the higher end. Amazing Grace kind of fits versus Bob Marley or, I don't know, some...
Taylor Swift.
I was just going to say it.
Some Justin Bieber.
Swiftification, yeah. Does that make sense? So the way the music therapist approaches a young child or an adult or a geriatric patient is, what do you want to do today? So it's a completely open-ended question. They might have a song in mind. So Kat might say, play Three Little Birds. You might say, I don't have one in mind. And they'll say, can we create something together? Recently I had have you heard of Capital Cities? Safe and Sound, that song? He was nice enough, the singer with the long beard. He was nice enough, he's like, let me do something for you guys. I said, okay, we got a studio in LA that they'll let us use. It's the iconic Village Recording Studios. And one of our patients, 21, was depressed. And the mom's like, please do something about this. I said, have you heard of Capital? He's like, yeah, I love them. And I said, you're going to spend 4 hours with the singer. He's like, wow. So a little bit of less depression. On the way there, Seb with the singer calls me back. He goes, dude, this guy doesn't even, he's not musical at all. I'm like, you volunteered? Get yourself out of that mess. Do something. The kid brought a book of poems with him. And they actually wrote a song on the spot. And it's beautiful. I don't have the rights to broadcast it yet because it's going to come out soon, called Menacing Wolves. So it's all his inner demons. And Sebu put it into this beautiful piece that starts very just intensely and like cacophonic into a smooth finish in the end, which is, I mean, he should get a degree in music therapy almost. So sound baths, tuning to 432, these are all things that, again, we haven't even scratched the surface. Heck yes is what I would say, and let's get more hands on deck to do this. So thank you.
I absolutely love all this. I have an integrative wellness practice in Pittsburgh in which I specialize in treating anxiety and depression and using different modalities such as music to raise vibrational frequencies for healing. And it's funny to say about the immune stuff. My dissertation for my PhD program is in integrative wellness, but it's looking at response to music and vibrational frequencies in that area. So my question to you is, how can I get more involved in my own practice to incorporate the Children's Music Fund into my own business and help others as well?
Music to my ears. I'll give you our contact information. Yeah, we'd love to do collaboration because it's only, you know this, my dear, he's like my brother, Dr. Rydell, yesterday talked about during fellowship. We had about 103 IEIs or PIs that we knew. It's 4 times that now. Why? Because a bunch of people got to work and took it seriously and did the work. And that's just 20 years, right? Quadrupling the effect. And here I feel like we're literally, we can only go up from here. So yes, definitely want you involved with us.
It sounds like a lot of good vibes there.
Yeah.
Hi, thank you
Please.
for the subject. You're probably aware of this because a lot of the research came out of Boston, but another rare disorder, Tourette syndrome. In a nutshell, it's an anxiety-based disorder. So when they're more anxious, they tic. And my son has a severe case. And playing music and listening to music, whether it's active or passive, eliminates tics. And this has been proven in studies. And they did a movie called The Tic Code, which is probably ancient at this point, with Gregory Hines, that proved that. So I really encourage trying this for yourself if anxiety is something that, I'm only speaking on that. I know it's anecdotal, but I do have the research, I just don't have it with me. And I want to thank you because I know that Children's is part of all that too. So, and I'm a Bostonian, so there you go. And, thank you.
Well, you hit it on the head. Your child, that case is anecdotal. Most of the medicine is anecdotal. So I was in charge of the pediatric pain program at UCLA. The reason I got into it was coming back from Boston, I was like, who's going to help me propagate music therapy? It was the pain specialist, Dr. Zeltzer. And she said, if you work with me in clinic, I'll do anything you need. And I needed music therapy as part of her CAM team, her complementary and alternative medicine. She had physical therapy, hypnotherapy, craniosacral, massage, you name it, Reiki, obviously family therapy, child psychology and psychiatry. I'm like, where's music? You got art therapy, they're diagnosing abuse in the house with art. All these are therapy. So if it's done right, you can only have good come out of it. Instead of, for Tourette's or other tics, what the anecdotal treatment is, try Benadryl. I'm like, why do you want to sedate this kid when they should be awake, present in life, and with music, they're not just present, they're engaged, and they're producing something, not just for them, for the rest of, maybe the household at least, maybe the neighbors.
And that's what it is, the engagement part.
Yeah.
That helps it go away.
Yes, we've dehumanized a lot in society. Now it's time to go back to, that's why I start with the birds and how you talk to your dogs. I forget you said it, you know, and the dog doesn't understand no or yes. They didn't study that in canine school. It's more no and yes, you know. So all that intonation, that's how kids learn. And then those words and sounds and the velvety touch around them come to life.
We have a question here.
Yes, hi, thank you for your work. I have a question. There have been some studies on the music of Mozart. And one of the earlier studies, and I don't know when it was they analyzed, I think it was some of the frequencies of the music and the meter of the music. And then they did EEGs of people listening to the music. And it gave them like slower brain waves.
Yeah.
And I don't know how much of that is incorporated into your work or your studies. And then there was a second study, and this was maybe 10 years ago, where they had children listening to Mozart, I think like every day at home. But those children, when followed long term, did cognitively, they were farther ahead in school.
Yeah.
I don't know.
So our chair of research, of the research committee, Don Griffin, was one of the main funders for the Mozart Baby Effect. And this is going to be music to his ears when he listens to the taping. He's out in LA. And the reason I'm like, because I ask all of our board members, like, I'm honored that you're part of the team. Why are you here? And for him, it's, well, we did this rudimentary study a few decades ago, and it turned out that these babies went on to be better mathematicians, right? Like you said. And what we're doing here is like even, steps above that for intricacy. And you are absolutely correct. Because think about it, music is math, it's physics. All right, it either resonates, you're either looking at a helical kind of a conch shell that's just expanding to rhythmic meter, to some of you here, I think your anxiety drops once you get on that escalator. There's 2 or 3 escalators in this hotel. And otherwise it's like, where do I go? It's a labyrinth. But once you hop on that escalator, at least for that 10 seconds, you're like, I'm going in the right direction. But that's math. There's a musicality to that too.
We only have time for one more question. If you have a question for Dr. Rafi, you can always go and find him at thecmf.org. Or if you see him in the hallway, I'm sure he'll answer your question. But let's get one more question in, and then we'll wrap this up.
Hi, I'm more on like the side of music where it's like louder metal, rock, and I'm not. Yeah, there we go. I know it's not really like many people in the room. They seem like more like they like calming music, but I've always found like louder music more calming. Is there like any sort of study that you've done or seen that like proves that like louder noises or something like that calms other people? Or
great question.
I feel like Dr. Rafi is a Tool fan.
Yngwie Malmsteen, go look him up, fastest shredding guitarist. I'm a Rush guy, actually. I love Rush. Can't get better musical talent than that. So to go back to your question, that's a tough answer because you're comparing apples and oranges and melons. There's no way. The other way, you got to reverse engineer and say, how do you feel with your choice? And if your choice is Sepultura or Pantera or Rob Zombie or something, that's just as effective if it's working for you as Cat's Bob Marley, or Julie's Bach or Beethoven. So in the end, you got to look at what's the outcome.
What is Julie into?
EDM.
There you go.
EDM, yes. I'm honored again to be here. I hope to be invited next year and bring a music therapist and do some sessions, hopefully, and just keep staying engaged because there's a lot more we could do together. And remember, there's only 2 kinds of music, good and bad. It's all up to you.
And that's very perspective, right? Because I like what you said earlier. Someone's Metallica is someone else's Mozart, and vice versa. Music is like beauty in the eye of the beholder. Thank you so much for this presentation. Please give Dr. Rafi a huge round of applause. Please check out his website and learn more about music therapy in your area, and or just contact Dr. Rafi's organization to learn more about how he can find you in your local area. Again, I want to thank you for your participation, and don't forget about Ask IDF for all of your other questions. And if you need peer support, please check out our IDF website for our Get Connected groups. They offer those in the PI community and their family members opportunities to connect, share experiences, and receive support in their local communities. We also have a Get Connected group for young adults, so check that one out as well. Thank you again so much. Give yourselves a round of applause.